Childhood neglect is a type of childhood trauma that can have long-lasting effects on a person's mental, emotional, and physical well-being. Neglect is defined as the failure of a caregiver to provide for a child's basic needs, such as food, shelter, clothing, medical care, and emotional support. Neglect can be intentional or unintentional, and it can occur in various forms, such as physical neglect, emotional neglect, educational neglect, and medical neglect. Physical neglect is the most obvious form of neglect, and it involves the failure of a caregiver to provide a child with basic necessities such as food, shelter, and clothing. Children who suffer from physical neglect may experience malnutrition, lack of proper hygiene, and exposure to unsafe living conditions. They may also suffer from health problems such as infections, diseases, and injuries. Emotional neglect is a form of neglect that involves the failure of a caregiver to provide a child with emotional support and nurturing. Children who experience emotional neglect may feel unloved, unwanted, or unsupported by their caregivers. They may also feel ignored or dismissed when they try to express their feelings or needs. Emotional neglect can have a significant impact on a child's emotional development and can lead to issues such as low self-esteem, depression, and anxiety. Educational neglect is a form of neglect that involves the failure of a caregiver to provide a child with an education. Children who experience educational neglect may miss school frequently, may not be enrolled in school at all, or may not receive the necessary support and resources to succeed in school. This can have long-lasting effects on a child's academic and professional success. Medical neglect is a form of neglect that involves the failure of a caregiver to provide a child with necessary medical care. Children who experience medical neglect may not receive routine checkups, vaccinations, or necessary treatments for illnesses or injuries. This can lead to serious health problems and can even be life-threatening in some cases. The effects of childhood neglect can be long-lasting and can impact a person's mental, emotional, and physical well-being well into adulthood. Children who experience neglect may develop a number of negative coping mechanisms, such as substance abuse, self-harm, or avoidance behaviors. They may also struggle with trust issues, difficulty forming healthy relationships, and low self-esteem. In addition to these emotional and psychological effects, childhood neglect can also have physical effects. Children who experience neglect may be more likely to develop chronic health problems such as obesity, heart disease, and diabetes. They may also experience developmental delays and cognitive impairment. Treatment for childhood neglect often involves therapy, support groups, and other forms of mental health treatment. The goal of treatment is to help individuals heal from the trauma of childhood neglect and develop healthy coping mechanisms and relationships. It is important for individuals who have experienced childhood neglect to know that they are not alone and that there is help available to them. In conclusion, childhood neglect is a form of childhood trauma that can have long-lasting effects on a person's mental, emotional, and physical well-being. Neglect can take many forms, such as physical neglect, emotional neglect, educational neglect, and medical neglect. The effects of childhood neglect can be profound and can impact a person's life well into adulthood. It is important for individuals who have experienced childhood neglect to seek help and support in order to heal from the trauma and develop healthy coping mechanisms.